Hello, everyone. My name is Dr. Ismaili, and I'm going to present to you guys a presentation about the shrinking face epidemic, and the rest will lead you guys to read for yourselves. Here's a bit of a disclaimer I would love to make before I start. The information that I'm going to be presenting here is only for your education and entertainment purpose and should not be used exclusively for clinical decision-making. And I have no affiliation with the products or websites I'm about to present. And I have a little bit of a sideline disclaimer as well to make, that there's a healthy and an appropriate dose of sarcasm exercise in some of the slides. Viewer discretion for interpretation and humor is advised. You are about to find out why. So these are some of the learning objectives. I'm going to leave it there for a few minutes for you to glance over it. By the end of this presentation, I'm hoping you can catch at least 2 or 3 of these bullet points that I'm presenting here and gaining some understanding of the rest if you are unfamiliar with the subject. So here how we're starting, fresh and early. I hope that by the end of this presentation, with the amount of information I'm about to present to you, we do not live in this state. This is part of the sarcasm I warned everybody about. Speaking of humor, so this is just purely meant for, again, sarcastically mentioning how our medical system and our allopathic and mainstream medicine dentistry have missed a few marks of the connection between mouth, the body, and everything in between. So this article came out, as you can tell, the date was April 1st. So there's a bit of an April 1st Fool's Day in there as well. Said that a multi-center, multi-year study connected the mouth to all the rest of the body. And again, knowing the date, you could see that if we were to really just go out there and announce that we are now finding, with the light of new information, how the face and all the facial features are connected to the rest of the body, which I will be presenting here, this wouldn't sound so much funny anymore. So if Dr. Seuss were to write a new book about the story of the dentist and the airway, craniofacial development, and disordered breathing, it would look something similar to the story of the spooky pants, the green spooky pants with nobody inside them. This was me when I started learning about the TMJ, the airway, and all of the craniofacial aspect of dentistry. The subject was pretty much like the green pants, the spooky green pants with nobody inside them. The subject would scare you because the minute you want to treat this, you are aware you're disrupting the harmony that exists in the system. And most of us at the early stage of coming out of dental school avoid the subject altogether. But this is how I ended up, and I'm hoping I can help my colleagues end up in a state of peacefulness with the green pants with nobody inside them. That in fact, we can embrace, and we should embrace, the connection between airway, the craniofacial development, and disordered breathing, because it's inseparable from this state of dentition that we treat. So with that said, this is what I came to understand after I spent about 4 years leaving clinical mainstream dentistry, focusing on the body that hosts the teeth. The craniofacial, the skull, the body that holds the teeth. This is what I concluded. The age of genetically modified food and epigenetically modified human. This is a skull of a human about 200-300 years ago. Broad arch, look at the nostrils, the symmetry that exists, and all the bones that are in a neutral position and a functional state. If this skull was covered by soft tissue, we would be seeing giant nostrils and a resonance between the bones for function. This is the skull of a human being, a human child, this generation. And no, this does not belong to an alien. It's actually a child in my practice. This is a common finding we see: asymmetry, the bones that have not fully developed to their full potential, compensation in all different parts of the head, and a growth that does not, that cannot meet the demands of a growing child. So what happened with every breath, and why I'm so huge about addressing that? Well, it's simply put, there are 22 bones in our skull, and there's 3 at the very bottom of the skull, at the spine. The bottom of the spine is the tailbone, or the ilia. Sorry, the sacrum is connected to the 2 ilia, and the combination of the 3 of them act as a support for the spine that supports the head, 12-pound medicine ball, the very top of it. About 8 to 12 times per minute, those bones go into what is called flexion and extension, literally pumping this spinal fluid around the brain and spinal cord for one purpose: to bring oxygen and nutrients to the brain and remove waste. That's one of the main functions. It's the essence of life. That's what happens with every breath. So we breathe about 12 to 16 rate per minute. And this act of moving the spinal fluid around the brain and spinal cord called primary respiration. So now that we got that in check, let's talk about disordered breathing and disordered respiration. So I use breathing and respiration not as a synonymous, the same word, but those are actions that happen together, parallel, but they're not exactly the same. So when bones, the 22 bones in the skull and the 3 bones at the bottom of the spine are out of order or crooked, which we're going to get into the reasonings of why, that process is disrupted. So the spinal fluid does not go around the brain, and all of those functions that need to happen, they're halted, which would alarm the body and the brain into the state of dysautonomia, which is upregulation of a sympathetic nervous system that is meant to alert our body. The brain alerts the body that something doesn't feel right because I'm not getting what I need. So that sympathetic upregulation in turn causes all of this laundry list of things. The inflammation turns on, energy expenditure mode is turned on, reduction of function, and state of alertness. You can see nothing good comes out of that. So what happened to the human and why did they end up crooked? Misaligned bodies and crooked faces. Modernization is what happened. The last 200 or 300 years, humans have become machineries, and our lifestyle is demanding our bodies to become machineries. And that modernization has caused the state of compensation, meaning an environment that is exposing our bodies from the minute of conception to the birth and then some. It's asking and requiring a lot of changes that are not encoded in our genetic. Well, genetic is a bunch of codes that are written, and every single one of them gets activated according to what the environment is expecting it. When there is changes that are not compliant and they're not consistent with the state of function, the body goes into the state of compensation. So what happens? What are the modernization? What are some of the examples of modernization that require compensation? High cortisol in the amniotic fluid. Let's start from the minute that child is conceived. Moms, the maternal age rising, moms having to work outside the house, and the environment that is the cortisol production in the amniotic fluid is not allowing that baby to fully potentially develop to its state of function. Trauma during birth, suction deliveries, C-section, breached babies, anterior position, which we're going to get into some of the levels of details of that later in this presentation. Extended time in the car seats, that's a big one we have not even started talking about. Insufficient breastfeeding, which is tied to tongue tightness, and it's potentially connected to the fact that the high cortisol amniotic fluid is not promoting the child to move around in the womb, and is basically in the state of trauma pattern, basically keeping itself away from the environment that is not safe. The cortisol in the production, cortisol in the amniotic fluid. The rubber shoes on even floors. Let's talk about that, because if everything was good and perfect until this child starts walking and standing upright, our system was meant for uneven surfaces. Our body organs are on the one side of our body so that we can propel on uneven floors to challenge that balance. Walking on uneven floors, grass, riding on horses, climbing boulders, none of those are the things that kids are getting exposed to. So what does rubber shoes have to do with it? The sensation of the ground from the heels all the way through the thoracolumbar fascia to the spine to the neck would allow the brain to process and analyze the three-dimensional, how the body is moving in three-dimensional space in 3 different planes. The rubber shoes will disconnect some of that, and it creates an element of instability and lack of communication between the heel and between the surfaces of the feet all the way up. So basically that exposes another round of compensation to the body that's already incurring so much and walking on even floors. When the floors are even, we end up being uneven. And then modern homes, which is nothing but a sensory deprivation chambers. We were created to have 30 degrees of lordosis in our in our neck, 30-degree of rotation and lateral bend in our neck to see the horizons, for our ears, even the sensation on our skin and eyesight to assess the 180 degree of the horizon. But when we are in sensory deprivation chambers, walls and floors that are converging us, sitting on screens, computers, cell phones, that's being restricted, and that sensation, that sense of hearing and sight and equilibrium does not quite develop. Again, lacking in compensation. Another one that I forgot to put in here is the whole nonverbal communication, texting, lack of using the throat, the tongue, besides the fact that we also have artificial food introduced to the mix. So by the time this one gets into the equation, there's multiple layers of compensation already happening before the child starts even eating. So from their formation, breastfeeding, the mobility of the tongue, breathing, walking, balancing, sensation of eye, hearing, all of that already been in a state of compensation. And soft food. In my opinion, humans are the most brilliant animals to create artificial source of food, but we're also stupid enough to eat them. We're feeding it to our children whose bodies are developing and need the hard texture of the food to grow the bones and the face. And what we're giving them is what that melts in the mouth. Again, lack of requirement for the tongue to make its movement and coordination between the muscles, swallowing, developing the throat muscles, which means purpose of that is sustaining our airway. We start on the floors and then we stand upright. So between the time that we are on the floor on fours and the time that we're standing up, that distance from toddlers to when they stand up and walk, there's a lot that has to happen to that sharp 90-degree angle behind the nose for airway to develop correctly. And it requires all of these functions to be in the right place for that space, that throat stay open. And when we're lacking all of that and this much compensation already gone into it, we're looking at a body that is already dysfunctional. So I like to actually put this into analogies, because I love analogies and stories because it drives my message home easier. This is a piece of paper. It's a cell, one cell, a human being, before it becomes even developed to be an embryo. It was supposed to become a beautiful origami. But when the compensation from the minute of conception happens, the cortisol production, lack of movement, we're not quite getting an origami at birth. This is what we get. So what are the different stages that happen? Let's look at deeper into the details of different processes that happen. What happened at birth? Well, the trauma. Misaligned occiput in relationship to the rest of the skull. The tongue tightness, which all is tied into the processes of development. I think tongue tightness is the cleft palate of this generation. The narrow palate at birth. Again, when the face does not form, when the tongue placement is not correct at and during development, the arches become narrow and the whole skull does not quite feel developed. So there's some torque and twist already introduced to that piece of paper that's supposed to grow and become an origami. At 6 months, you have more compensation introduced. Insufficient breastfeeding, torticollis for using the neck for breathing because the position of the occiput is not correct and the child is not able to use nose to diaphragm breathing. The tongue placement is not correct due to tongue tightness, dysfunctional swallowing that follows it, deviated septum, and yes, mouth breathing. And then at 1 year, what do we see? We see a lot more compensation already introduced. It's overload. Breathing with gravity is now a compensation of its own. We talked about the environment that doesn't challenge the balance. SI joint or sacroiliac, as I was explaining, bottom of the spine, the sacrum to the ilia is unstable. The poor gait posture, rubber shoes, hard floors, and modern homes are the sensory deprivation chambers. As you could tell, we're not getting a fully functional human. It's a body in a full state of compensation. So what happened in the womb? Is this really genetic or beyond? And this is an article I pulled from the internet, and this is the link if you're interested to read on it. But the title reads, "Too much stress in the mother during the gestation affects the body through the amniotic fluid." We know there is so much information already out there, and not much of that knowledge is integrated into treatments and understanding how the kids are born, how they're developing. And by the time we see them, they already have a set of teeth in there that are signaling to that body that is not aligned. And our treatments have not changed in the last 200 years for them. This is the skull of a child in the womb. different parts of the skull, and connection to the sutures between them are not solid because the child has to go through the birth canal. This is another view of it. Again, I referenced here the website I pulled this up from, just in case you're interested to look it up. So those plates or tectonic plates in the skull are meant to be floaty so that the child can go through the birth canal. But we talked about just even before the birth process, the fetal position or fetal attitude, which I thought fetal attitude, the attitude is something they acquire when they're teenagers, but it seems like they have it before birth. But flexion and extension. So if the head is in the correct position to the spine, and the hands and the child is descending correctly, and the position of the head is correct for delivery, or it's an extended position where the head's going backwards and the child's position in the mom's womb or hip is not optimal for delivery. And the fetal presentation, I just wanted to present this information to dentists because this is something we probably never looked up, or it wasn't taught something in dental school. But the body parts of the fetus that are at lowest position of mother's hip for delivery is uber important. And where the child is positioned, or the fetus is positioned before the birth process at full term is initiated, is super important about what happens to all of those skull bones, the occiput, the position of the parietal bones, and the jaw and everything else, and how the child passes through the birth canal introduce the first and the most important crucial layer of compensation. These are just different positions depending on if the face is up towards the mom's spine or away from mom's spine, to the right or to the left. Each one of them comes with its own compensation. So or a breached baby, that's even worse. A cesarean delivery comes with another layer of complication of its own. But just to let you know, the layer of complexity that's introduced before we even have the baby in this world. So this is a visual presentation of a skull that's twisted as it goes through the birth canal and never gets detected. So we can all agree that none of this are in a complete arrangement and in the right place. And this is what I call scoliosis. This is not an actual medical term. It's something that I coined, and I think it's easier for me to describe this because we can relate to what is the state of a skull that is not in a neutral, cranial neutral position. And that body and that head is supported over the spine, and it belongs to a body. And as you can tell, those little strings that controlling the head and the position of that head over the spine and the feet, those little strings are the fascial tissue that once are tight and pulling on one side of the body more than the other, are introducing all the neurological deficits that we're going to see as I go through the rest of this presentation. No, at this point, dentists are just asking, what do teeth have to do with it? Why am I hearing all of this information? How does that relate to my area? I'm going to ask you all, put the loops down. That's the only way we can see what teeth have to do with it. So eruption of the teeth, I look at the teeth as neurological organs. They are, in fact, erupting in the system, signaling and following the neurological pattern of the body. The bones that carry the teeth, the upper and lower jaw, have no connection to each other until the teeth come into the mix. As a matter of fact, mandible itself doesn't have any actual hard structure, sutural connection to the skull until the teeth are introduced to the mix. That's my argument that mandible is not part of the skull. It's in fact an organ that directs the body mass, the neck, through the hyoid bone to the shoulder. It's literally a connection between the body and the head and the neck. And a lot of reflexes go into that. I covered much of that detail in my last presentation about mysteries of the mandible, but that is the argument that teeth are in fact neurological organs that are signaling the growth of the body, and they come in the mix as we grow. At 6 months of age, what happens? 2 front teeth come into the mouth, and as the teeth come into contact, the child's able to stand upright. When the teeth contact each other, periodontal ligaments through the mesencephalic will let this brain know where the head is, where the body is in 3 dimension. So if the bones that carry those teeth are not in close proximity of each other, they're not in a correct position, and they're cranially off in 3 dimension, the teeth will signal that same message to the brain. So now that next layer of compensation is introduced. Some of it was already there from feet up, some of it from top down. And as you can see, The twist and torque like a pretzel is being introduced into the system. So the teeth, we already established, are messenger between the skull and the body. How? Through swallowing. That is the only time that the teeth come in contact with each other and the periodontal ligaments produce that message to the brain about the state of the body. So if the teeth are in a good position, because the bones that carry them are in a good position, the neck and the shoulder and hyoid bone that carry that mandible are in the right place, and all the cranial, the structure of the face and the skull that are holding the maxilla are in the right place, that message gets translated or transferred to the brain. And by the way, that's a direct process to the brain. It does not go through the brainstem. It goes directly to the brain. That will let the processing center know that this system is functional 2,000 times a day. And that's a reward for the system. All is good, all is great. Now, if the teeth are not in the right position, they will in turn communicate that opposite message to the brain. And this is, if you were inside the brain, getting those messages from the teeth every time the teeth swallow, it's like, why? And that message gets to the brain, and that over-processing, it starts shifting the state of autonomic into outside of parasympathetic into the state of sympathetic nervous system with every swallow. So crooked skull and misaligned hip will come with a consequence, which would be twisted skull and hip. Why? Because when that message goes to the brain has to do something about it. It has to align and structure the rest of the system to comply with what's not working, which produces what I call scoliosis, which is the actual twist and turn in the spine. That is leading to dysautonomia. I just explained that. What happens is when the body is out of alignment, when you're looking at a body, a person standing up, outside of what should be going from their head all the way to their feet, is a strain line, as we call it, a green line or the green zone, like golfing. When they're standing outside of that, head shifted, face shifted, eyes shifted, the shoulders are out, and the hips are misaligned, the question to be asked, is this a functional autonomic nervous system? Or is it an autonomic nervous system that's leaky, is sympathetic overdrive, and is costly? I think you already have the answer. Teeth erupt in the mouth that belongs to a body. So if the body is misaligned, the misalignment of the body and the misalignment of the head will lead into the state of crooked teeth. So the teeth will not have a chance to come into a straight system. The body already is out of alignment, and the teeth come in, and the body says, this is where you're going to be. And when the teeth come in, they're torsioned in, they're crooked, they are in a misalignment as far as the cross bite, underbite, deep bite, because the body did not have a chance to put it in the correct place. So what did the dentist see? They see crooked teeth, as I just explained, short vertical dimension, setback chin, class 2 malocclusion tendency. The nose and the chin are by about an inch to inch and a half off. The actual canted occlusal plane, when you're looking at the maxilla, which is the airport where the mandible lands on, the maxilla being canted is one of the biggest indicator of a crooked skull. So this is where I bring the message home of what the teeth have to do with it. Because if you're looking at all of those, that's the only thing that the dentists see. But if we can reverse engineer that to the dysautonomia and the state of misalignment of the skull and the spine and the hip and the rest of the body, you could see that it all started elsewhere. This is my favorite picture to just bring the message home. Symmetry or asymmetry. The difference between these two, they're both in somewhat of an homeostasis. It's just that one is more costly. This one is free, neurologically free. This person doesn't have to think about that breath, doesn't have to think about how to stand up, how to propel in 3 dimensions, because everything is in a communication. The body is like a cruise ship. All the systems have to work in harmony together to propel, stand up, breathe, and balance, and be socially engaged. When 1 or 2 systems are off and the body goes into a state of misalignment or asymmetry, now the sirens are on and they're never turned off. And every single one of those sirens that are on cause some physiological, neurological, orthopedic, some form of a dysfunction that becomes costly, as I call it, financed. That breath and that person's standing up just to walk is costly and taxing on their nervous system, and is laxing and taxing something else that they need for a long term. Besides the fact that being dialed into low grade all the time, sympathetic overdrive or traumatic zone, that basically is going to overwhelm the system, and it will take away from the parasympathetic branch. That means everything else that is important for thriving of that patient, for their digestive tract, for hormonal balances, for brain and body balance, is halted to some degree or another. So digestive tract problems, anxiety, depression. If you're looking at the crooked body, this is where I really want everybody to look at the crooked body and say, what is it costing that patient? And what are the symptoms that are coming with that cost? So we already talked about scoliosis. I would like to equate that to dysautonomia and equate that with dysfunctional breathing. Why? Let's get into the reasons as to why. So that's just a visual representation. I just want to get everyone on the same page. Here's where the skull should have been, ideally, and here's where it's twisted. We already covered the reasons as to why. Let's looking at one example of a patient that might walk into your practice. This has just happened to be a familiar face for most. And if we were to peel off the skin and see underneath, we see something close to this. So let's just draw some lines. The teeth and the eyes, and looking at the actual position of the ears. So now you're starting to see, does this have a flow? Can this person's nose and the tongue and the airway get the air passively to the lungs? And once the oxygen is loaded into the hemoglobin, can it, with the movement of the 22 bones, get to the brain through the primary respiration? I think you can answer that for yourself. This musical system is not functioning at the 8 to 12 rate per minute in a complete full 100% cycle of the respiration. So CSF, or cerebrospinal fluid, the liquid that is delivering all the nutrients to the brain, removing the toxin, is got to clog somewhere. And that's where I call this a breathing and a respiration dysfunction because of the position of the bones. So the face will have all the clues. You don't need to see the bone to know that. And by the way, quick disclaimer, this CT does not belong to Mr. Kramer. I just, like I said, I just wanted to pull an example that would be similar to what I'm seeing in a clinical setting. So let's cover some of the compensation that comes with a crooked skull and crooked spine, or misaligned body and a misaligned hip. Disruption in form. Posture. Head over the hip. When we're standing up, our body is the mass that controls the position of the head so it doesn't fall forward. And the support that comes from the feet. So the base and support and how that information from the ground is transferred to the hip decides the leveling of the hip. So if we think of it, our hip, and mainly the position of the bottom of the spine to the two ilia, or the sacrum with the two ilia, think of it as a tabletop. Anything that's below supporting it are the legs. And if those are uneven or unstable, or there's a shim underneath one of the legs, that would introduce an element of instability to the posture. And then that would be translated to this little stick, which is our spine, that is meant to have particular curvature in certain places to support the head all the way on the very top. Diaphragm happens to be right smack in the middle of that. So when the curvature of the spine from the cervical portion to the lumbar portion is out of order or compensated, that will directly affect the activation of the diaphragm. So to be able to use the diaphragm fully, we need to have the support from the feet, and we need to have the head in the right place over the cervical spine and the right curvature in the spine. When that's disrupted, diaphragm is not functioning correctly, and that's the pump that's broken. Cerebrospinal fluid, we already covered that. This is the most important function in our body, is the, like I said, essence of health. So when the body and the skull is, or the skull bones and the hip bones are misaligned, the pump, the spinal, the sacral pump is not working. That fluid running around the brain and the spinal cord is also compensated. So some of the functional compensation, breathing from nose to the lungs, which requires the diaphragm to work correctly. We already established in a hip spinal curve that is misaligned, diaphragm is not fully functioning, especially when the rib cage is out, hips are overextended, and in a forward posture, thinking of the hip as a bucket. So if a bucket is in the middle, it's in a neutral position. But if the bucket is pouring out, that is an unstable or a hip that is extended, and that's causing the activation of the muscles that are supposed to make the diaphragm work, namely the abdominal muscles. transverse abdominis, the IO, the TA, the transverse abdominis and its buddies that are supposed to pull the rib cage down and activate that parachute, that diaphragm to get the air in and out of the lungs for full capacity, and the actual respiration. So what happens with dysfunctional breathing through the mouth, which we know if the nasal breathing is impeded, now we're mouth breathers. What is mouth breathing causing to the system? Disruption in the level of CO2, which is a more important gas than oxygen. CO2 is what is making oxygen available to our system by setting the pH at the tissue level. And with mouth breathing, that's disrupted, and that directly impacts the pH, and it causes a physiological compensation layer to the system. So now we have learned there are clues that tell us the breathing and respiration is disrupted. What can I take away from this presentation for the time I spend here? To go home or to practice and start looking at people and asking questions. So I'm going to give you a bunch of chairside investigator clues, the things to look for, because again, face has all of the clues: the tongue, nose, eye level, ear level, chin position, midlines, and facial proportions. I'm going to cover some of the fun details about some of them. So the autonomic nervous system and control of the mandible, I want to cover some bases here in the scientific term before I start giving the clues out. Mandible is, as I covered before, is not connected to the skull. It's a floating bone. It's a U-bone that's controlled by the hyoid, connected to the shoulders and to the cervical spine, in particular to cervical spine number 1 and 2, that are directly affected by the position of the occiput, which is base of the head, and it's connected to the temporal bone, which houses the TM joint. Now you can see the loop coming to closure. So what decides where the mandible goes? Reflexes. Body made the mandible a floaty bone for a reason. So wherever it goes, it becomes the liaison for all the reflexes functioning together in harmony. So what are the reflexes or the structures that would signal those reflexes? Maxilla through the interarch relationship. And ideally, I should have put this at the very last because teeth do not come into the mix until much later, but let's surpass that for now. Connection to the cervical spine through the parapharyngeal muscles. So all the muscles in our throat, behind the tongue and the palate that are connected to the neck are in fact connected to the mandible. So cervical spine position directly is going to be in communication with the mandible to make sure the pharyngeal space is patent. And if there's asymmetry in the system, one side of those pharyngeals work and the other one doesn't. Cervical spine is out of alignment. And so is the mandible. One side of the face is forward, one side of the body is forward. You could bet that parapharyngeal space is not optimally functioning. The cranium through the TMJ. I just got done explaining that the fossa is connected to the occiput, and that's holding the temporomandible joint through a bunch of ligaments and a bunch of nerves. Practically most of our cranial nerves pass through the temporomandible joint in that area. Our balance center is also in the same space. So those reflexes are directly communicated through position of the mandible and the hyoid bone. There are 136 muscles connecting the mandible to the hyoid, to the cervical spine and the shoulder. And the physiological harmony between those muscles is super important for all the functions to be corrected. One of them being balancing and directing the body mass in 3 dimensions, which happens directly through the mandible. Where head goes, the neck goes. Where mandible goes, the body goes. Why? Because body employs the body mass. The body mass is employed to support the head. So mandible is what's directing it. And it's super important for the mandible to communicate that information to the brain correctly. And how it does it is through the teeth, through the maxillary teeth. That's why we do not walk until we have teeth. So nasal function is the most important for me to decide the position of the mandible because it gives clues as to, is the diaphragm working? Is the space working? Is the pharyngeal space working? Because the flow is function. So how do I connect the cranial and postural distortions is literally through the nasal function. And what I mean by that is not just what's happening in the nose. It's what's flowing from the nose all the way to the apex of the lung. So postural asymmetry is already reflected in diaphragm. And the most important phase of that is exhalation, because inhalation happens when the barometric pressure allows the air to get into the lungs. And when it gets to a point where the barometric pressure and pressure inside the lungs are equal, then that pendulum stops. And now the recoil of the lung will swing the pendulum into exhaling and getting the air out of the system. That exhalation phase is where most of us neurologically are weak, and that's turns into mouth breathers. Breathing through the nose and zone of oppositions are completely directed, because if you're breathing through the mouth, we're chest breathing. Encourage everyone, just open your mouth, put your hand on the chest and belly, breathe through the mouth, and you will see that your belly doesn't move. Now close your mouth and breathe from your nose to your belly, and don't let your chest move. You figure out that you cannot breathe through the diaphragm correctly if you're breathing through the mouth. And the CO2 level and the pH. Super important, because incorrect route of breathing will affect the pH imbalance, which lead into a host of diseases physiologically. So now that we got our science covered, and we know mouth breathing is bad, sound like a broken record at this point, let's talk about the most important muscle in the breathing, which is the diaphragm, of course, after tongue, and how it reflects the function and symmetry. So if you haven't looked at the actual diaphragm, first of all, the one on the right side is larger as far as coverage and contact between the rib cage. It has a lot more zone of opposition. If you're thinking of a parachute that goes up and goes down, those connections between the rib cage and the diaphragm is much more on the right side, but we have a lot more lung real estate on the left side. So diaphragm has a lot of functions to reflect around with the asymmetry, and it's directly responding to the function and reduction of it if things are not working correctly. So if we're seeing someone who is not able to breathe correctly, it is not just in their mouth, it's not in their head, it's not in their nose, it's all the way from the chest, the position of the kyphosis and the thoracic spine, the position of the rib cage in relation to the hip, feet. All of that has to come together to be able to do the breathing correctly. So we can all agree the compensation happens from both top to bottom and bottom to top. And it could be a softer or hardware. Imbalance in the pH can affect the breathing and alter the route to the mouth breathing as much as the obstructions physically can. So I'm not going to go into details of that. I probably will cover some of this information in future presentations, but for now, we know that how diaphragm gets activated, the route of breathing and the mechanism of breathing and the physiology that goes with it is all reflected in this one muscle that connects everything together. So let's start with our clues. The tip number one, the eyes. Are we looking at the mouth first? The eyes will have every single clue you ever need. So looking at the level of the eyes, and as you can tell in both of these two gentlemen, the size is not much different, but the level is. And the bone that was holding the eyes, the sphenoid, is directly related to the position of the spine. Sorry, the skull. And it is connected to the maxilla, which is the bone that we all see in the mouth, through the palatine bone. And we're starting to connect the dots here. And the actual shape of the eyes. So if the skull is twisted on one side or underdeveloped on one side, you will see that not only the level, but the actual size of the eyes will be different as well, which means that the other bones are also not moving in the right, correct phase of respiration. So these will be your clues. Are the size the same? Positions the same? You don't need to know what it means at this point, but start looking at people's eyes and faces, and you will start noticing a lot of patterns. Tip number two, the nose. So the first is look at the asymmetry. If the nose is pointing to one side of the face or the other, it is showing where the middle of the face is and connection to the middle of the palate or the maxillary bone. Nasal valve collapse. Have your patients breathe. So this one is a bit of an over-exaggeration, perhaps of the, or not over-exaggeration, but this is the worst case I could pick, but I wanted to bring the message home. Have your patients breathe, deep breathe through their nose and shuts down. Almost like this kid is walking around with a pin on a hairpin or clothespin on his nose. This is a very serious condition, which basically starts the obstruction right at the level of the internal valve. It's a cartilage issue with the nose, the deviation of the septum that speaks volume of the crookedness of the skull and position of the bones in the middle of the face, back of the front of the face to the back of the skull. And audible breathing. The simplest test that dentists can perform is patients already are in a supine position, have their mouth closed, close one nostril and listen to their breathing. Close the other nostril, listen to the breathing. Is one more audible than the other one? Or just have them breathe with their mouth closed. Can I hear them breathing? And then tongue on a corner of the mouth as what's called the Connell maneuver. So right now, just do it on yourself. If you're pulling on both sides of the nose and you do not hear them breathing, or they feel like I can breathe better, that's a positive finding. And it's speaking about the crookedness and the route of air passage through the middle turbinates, through the inferior turbinates, sinus relations, and the whole breathing mechanism, and is clued to the mouth breathing. If you can hear audible breathing from the nose, you know if the brain has to choose from a route that is so obstructed and becomes even more obstructed in the supine, it will pick the mouth breathing. I apologize, it should be tip number 3 is about the maxillary arch. The molar to molar width. It's one of the easiest things for dentists to do. Why are we talking about the widths of the palate? Because if the maxilla, the bone in the roof of the mouth, which is the floor of the nose, the bones are in the wrong position, and they have not been developed by the tongue that was restricted, and without a nasal function, you will see a very narrow arch. That is the biggest sign to the breathing dysfunction for that adult. So the molar to molar distance in an adult is supposed to be about 37 to 42, in that range. I don't treat numbers, I treat people. But if you want to have a number or something to go with, grab a cotton roll that's 35 millimeter across and put it between the first upper molars. Does it get snug? Doesn't even get in there and sit on the top of the occlusal surfaces? You already know that they are narrow. But if you want to measure, there's different references you can use to measure. The most accurate one is from the alveolar crest to alveolar crest, because the position of the teeth can, in fact, affect some of that circumference. The occlusal canting. The position of one maxilla on the right and the left, if one side is higher or maxilla itself is oriented to one side or another, this is a telltale of a crooked skull and a dysfunctional dysautonomia. The midline shift. Look at the middle of the face and assess if one side of the face is larger than the other, and look at where the midline lands. Again, that's a big clue. And the crowding. Clearly, we know that mouth is a small, but also the way that the teeth are positioned. Again, I covered some of this information in my last presentation. If you're interested, you can find them over there. And the biggest of all, the tongue. Tongue tightness. It's not uncommon, and it's becoming more and more common. And this one is a very restricted tongue that I picked just to drive the message home. We call this an Eiffel Tower. It doesn't have to be this bad. And one of the biggest functions is the ability to mate back of the tongue to the soft palate. And if there's restrictions with the fascia, with the tongue and floor of the mouth, and the patient is not able to lift the tongue to the roof of the mouth, that's a huge compensation for breathing and the growth and development. The scalloping. Have them swallow and stick and just open. You don't have to have them do anything different. And do you see the indentation of the teeth on the side of the tongue? And if you do, that's a big sign that the tongue is becoming the neck to stabilize the system. It's pushing against the teeth, is not going to the roof of the mouth. And all of those clinical signs are just coming together. White coating is a huge sign of mouth breathing. Having the patient, especially if it comes with a crease in the middle, you know that the microbiome or the candidiasis growth is directly related to the environment of the mouth that's inhibiting it. Mouth breathing is a big one. And the tongue posture itself. Don't have to go too far to know this does not resonate with someone who is in an alert state of mind. I mean, I'm just being, this is a part of the human that I would warn everybody about. But throughout this whole movie I was watching, this guy never closed his mouth. The low tongue posture itself is another clinical sign. And tip number 5, the soft palate. This is by a standardized classification of the soft palate, having patients swallow and open. You don't have to have them stick their tongue out or anything. There's Friedman classification and Mallampati scores. Do we have to have them stick their tongue out, or do we have to? I would just have them in a supine posture, have them swallow and open without any further instruction. Can you see the uvula? Can you see the back of the throat? And that's a class 1. If you can partially see the uvula and the soft palate and part of the posterior part of the tongue, then it's a class 2. If you're starting to see less of it in the 3, and if you cannot see anything at the back of the mouth, class 4. It's a huge problem with breathing and breathing disordered sleep. This is my analogy of the soft palate in relation to the whole skull, the position of the maxilla on the side of it. I see the maxilla as the tabletop, and the soft tissue, the soft palate, like the drapes. The shorter, the farther back the table is, the longer that drape. The larger it is, and more positionally optimal, the shorter the drape. So this is a Mallampati score of 4, and it's a Mallampati score of 1. Just a good visualization. So now that you have been armed with some of this information, look at some of these familiar faces. And let's take a look and see, are you looking at them the same? Cross the midline here. Let's look at the position of the eyes and the occlusal plane, the chin position, the nose position, the eye position. Now you're starting to see and ask the question, what's the state of autonomic nervous system and function? So I wanted to cover one case at least and go through some of the details and demonstrate how I would do my analysis on patients. The first thing I look at is the eyes, the level position. Does it follow the teeth? Where are the teeth? And as you can tell, maxilla is orienting itself to one side and it's higher on one side, and the eye is higher on the other side and rounder on one side. So looking at the face now, we see that there's a tilt in the head, and the ear position, the eye position on one side is different. Practically, one side of the face is smaller than the other. And look at the aloe of the nose and look at the chin. Where's the chin pointing? Where's the nose pointing? The sternocleidomastoid, the shifting of the whole entire head to one side. That's the muscle she's using to breathe. Definitely the diaphragm at this point we know is not functional. And how the head is shifted. Going farther back, the body that supports that. Now you can't miss it that one shoulder, the one on the left side, is higher than the one on the right side. Head is in a forward posture about a good inch in front of the cervical spine. Shoulders are rounder, and there's the kyphosis, apex of kyphosis is exaggerated here. So again, the lung is sitting right in here. How could it function? And also the shift, the whole twist in the horizontal plane. And the nasolabial angle, which speaks volume of the position of the maxilla. Now look at the body that holds that entire shoulder posture. Again, we're seeing the thumb here, and I can see more the back of the head. So shoulder is shifted, head is shifted, hip is shifted. So look at start from the bottom up. The ankles, the knee, hands, lumbar spine, cervical spine, and the entire structure. So I decided to put this in more of a story format instead of a diagnostic and medical terms. So this would read something like this. Dear diary, I was born with a crooked skull and unstable hip joint. I grew asymmetrical because of it. My brain was always aware of this. The sympathetic never turned off, and it turned my inflammation on. I'm financing every breath since the first breath, neurologically, orthopedically, physiologically. They straightened my teeth and left the rest crooked. Brain does not feel safe, so I cannot sleep. I'm using my prime movers to hold me in this awkward posture, to breathe, balance, and walk without my brain falling forward. And that's reflecting the rule of 3B. What could I do with all that energy tax if my breath was effortless? I would be more socially engaged. I would have rest and homeostasis take care of my body and brain, and I'll be sharing my gift with the world. It's coming from the straight teeth and the crooked body and face. So with that said, I'm going to show a few patients that I have treated to address that asymmetry in their body, that asymmetry in their skull, and their breathing improvement. This young lady, you can see the position of the eyes and the maxilla and the nose and the chin, and getting much better here. This is over a year and a half of treatment, multi-interdisciplinary treatment. This is the face at rest. Again, canting in the mouth, canting in the eyes, nose. And one thing that you cannot see here is that she was losing hearing in the left ear. She could not, even with hearing it, she could not hear anything on the phone. And by the time we were done with her treatment, she was able to get on the phone and hear and communicate and be a part of this world and enjoy her new grandchild. This is what happened inside her mouth when the bones were positioned in the correct place. And the tongue was able to do what it was supposed to do. The neck was, in a correct position, head over the cervical spine. Symmetry restorations, the creation of space in her mouth, and you can see now there is a lot more of her back teeth we could see. This is another amazing soul that I had the privilege of treating. This is on a span of 2 years because there was pandemic in the middle, so there was a halt in the middle treatment. You can see, I cannot help to see that people actually get much younger by the time when we dial down their sympathetic and we address those misalignments. The space in her mouth went from 24 to 30, almost 31. Again, I don't treat numbers, and at 31, half of her symptoms already dropped digestive tract breathing, most of the symptoms were addressed. And yes, she could sleep better because her autonomic nervous system was more dialed into ventral vagal. And this is a slice of her CT scan and some of the nasal septum that corrected, nasal passages and the turbinates that opened up, sinuses functioning better, and look at the tongue holding up the fort, fitting through the roof of the mouth and becoming an organ to help her function, breathe, and balance. And this is another amazing patient of mine that I treated. Again, we started with a lot of those features. You could see at this point for yourself that we created a lot of symmetry and function back into the system. Again, do we look for perfection? It's all about golfing. Get them as close to the green as possible. Younger they are, the closer to the green. The more compensation the body incurs, the farther they are, and it's going to require a lot more golf clubs and sometimes a couple of obstacles to go through to get them to the green zone and ball to the cup. In this case, very happy to see the change, the nasal septum deviation changing and the face coming into the middle and the maxilla getting centered. And that's what happened in his mouth. Again, not looking for perfection. It's all about the progress. So at this point, I just want to bring the message home, some final thoughts, take home message. What's my goal? My goal in every patient when I come through my door is to make them breathe effortlessly. And that is from nose to the diaphragm. That is the route of breathing that's good for our system, which means to achieve this, we're going to remove the blocks in the chain that makes them breathe with compensation because we want them to breathe without compensation. That requires the face, eyes, ears, maxilla, nose, chin to be in a symmetrical position. I think you guys know at this point, when things are not in the right place, they cannot function correctly. When the body is crooked, when it's not in a neutral position, it cannot provide the functions and it will automatically dial into dysfunction. And then correcting the posture that supports that head. So we have less sympathetic, more parasympathetic, more social engagement, less energy tax and reservoir of the body. Which turns the inflammation off because we know sympathetic comes with the element of inflammation that turns on. Digestive tract, hormone system, respiration, pH, all of those get much better, which will in turn reflect in the functions of the system. And yes, the body will feel safe to go to sleep. So when I started this presentation, the title I gave it was The Shrinking Face Epidemic. Well, the mouth will tell the story. By the end, when I put all that information and my thought process into the presentation, I decided shrinking face is not quite reflecting the message. So I'm going to call it the crooked face epidemic. And yes, the face will tell the story. So let's come together, use this information, these pointers I give to help humans do life better. Because if their bodies are not fighting for every breath, they have a lot more share, and every human has a gift to share. And we will know what it is when they can breathe effortlessly. So I'm going to go ahead and play a video. This basically is representative of what happened if the crooked face, the misalignment, was as obvious to every dentist, every movement specialist, physical therapists, chiropractors, even oral and myofunctional therapists, as a nail that would come out of their head. You hear all the symptoms, but let's watch the video. And I really would like this to become the nail in the forehead.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me. And I can just feel it, like literally feel it in my head. And it's relentless. And I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever going to stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there.
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing.
You always do this. You always try to fix things when what I really need is for you to just listen.
See, I don't think that is what you need. I think what you need is to get the nail
See,
out. Okay, fine. I will listen. Fine.
It's just, sometimes it's like there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
That sounds
is. Thank you.
Oh, come on. If you would just
Don't.
see things.
So think of the next time that a patient tells you, oh, my crowns are broken, my teeth coming back crooked. Just remember the crooked nail analysis. So with that said, I want to thank you for spending the time to listen to my presentation. I hope you walk away with something that is going to help you in your clinical decisions, and come back for some future presentations that I will be unfolding layers of onions on everything that I covered in this overview presentation. And here I would love to present my personal email that you can use to communicate if you have any questions, if you need a consultation, or any more further guidelines about anything I presented here. I'm available through this email address. And I hope that you enjoyed this and you come back for more.